Not that it is very much controversial. It is just an option. It is not mandatory. So if you do not even give methylprednisolone, you cannot be medically sued. You cannot be sued. So there are so many ways to immobilize. There are so many good cervical collars, bolsters. These are important immobilizers in emergency department. A combination of rigid cervical collar and supportive blocks on a backboard with straps is very effective. But long-standing practice of attempted cervical spine immobilization using sandbags are useless. And if you too tightly immobilize, what are the problems? Airway incompetence, aspiration, and there are pressure source on the spine. So advanced trauma life support guidelines recommend that use of orotracheal intubation to preserve airway in case of injury above C3 level. So here an assistant should help the person in intubating another one. One person will hold the face and the skull in straight line and pull slightly in a traction position, and the second person will intubate. So endotracheal intubation is most important. And the last one, if you get a patient like this with this acutely painful red swollen joint, always think in your mind that it might be acute attack of gout. Now, what are the clinical manifestations? Generally, there are a lot of misconceptions and conceptions and own conceptions about gout. So I'll try to brief throw some lights on gout. Now it generally happens, these acute attacks happen at night. Suddenly in the morning, one fine morning, you see that at the time of going to bed I was okay, in the morning I cannot move. So there is swelling, redness and warmth, and 90% are monoarticular. This is the common symptoms. Some important information. What is hyperuricemia? So serum level of uric acid more than 6.8 milligram per dl, it is hyperuricemia. More common in men, and in case of female it is after menopause. In young female you hardly see any gout, it is always after menopause. Excessive weight gain, hypertension, these predispose to gout. So diagnosing gout, how do you diagnose? It is serum uric acid estimation. This is 90% of all the practicing surgeons, physicians, general doctors, they go for uric acid estimation. If the uric acid is normal, you do not have gout. This is wrong. It is indicative. High uric acid definitely it indicates that you are suffering from gout, hyperuricemia. If it is normal, it does not rule out gout. It may be normal at the time of flare. So the most important analysis is if aspirate the synovial fluid, and if you get uric acid crystal, this is the diagnosis of gout. Urinary uric acid excretion is also important criteria. So synovial fluid analysis by polarized light microscopy. Now treatment protocol of acute gout. Rest. This is most important treatment for at least 24 hours. Elevate the painful joints, ice compress, and non-steroidal anti-inflammatory drugs. And indomethacin is a drug of choice after colchicine. And 150 milligram of indomethacin per day is recommended for first 3 days. And then 100 milligram for another 4 to 7 days. Do not take aspirin. It may abruptly initiate gout. So keep in mind that aspirin is contraindicated in case of gout. Do not give aspirin. So the treatment goal is reduce the pain. Immediately the goal is only to reduce pain, give analgesics as much as possible, protect against flares, recurrent flares, and treat hyperuricemia. And do not give anti-hyperuricemic drugs at the time of acute attacks. Do not prescribe any allopurinol, any drug during acute attack. So teaching point is hyperuricemia comorbidities are obesity, hypertension, diabetes, renal disease, etc. So how to prevent recurrences of gout? Control your body weight. How? Avoid fasting and very low calorie diet, because these two predispose to gout. If you want to lower your body weight very fast, you will be prone to gout. Because low calorie diets increase the amount of uric acid and initiate gouty attack. Why alcohol? Because alcohol reduces uric acid clearance through kidney, and particularly beer, they are very rich in purine, so avoid beer. Always try to keep uric acid level less than 6 throughout the life. And therapy should continue lifelong. Instead of, there is a belief that after 6 weeks, in case of gouty patients, stop therapy if the uric acid level is normal. No, because this should continue throughout the life. The target is to keep uric acid level less than 6 so that the kidneys will be protected. The chance of uric acid crystal deposition into the joints will be much less. So fast empty joint in foot is the commonest site. And some of the one or two penultimate slides. Which are the foods to be avoided? Livers, kidneys, I mean organ meats. Any meat in huge amount, any meat. Beef, pork, lamb, this should be avoided. And gravy, beer, this should be avoided. So what are the foods to be taken? There is another misconception that tomato increases, uric acid level. This is wrong. You can take tomato, green vegetables. Fruit juices you can take. Egg will be harmless for uric acid. You can take one egg a day. And to conclude, we are passing through an arena where there is a huge population explosion, and as emergency doctor, you are supposed to meet grave and graver accidents in day-to-day life. So our customers are very unprotected, and there is a demand always there to try to catch these customers, but we are there to protect them. So keep your fingers crossed. And I think in the evening we can enjoy like this. Thank you.